Markets dropping this morning after President Trump met with members at the GOP conference on Capitol Hill this morning about the latest rumors, or I should say the maneuvering on the health care bill. Conservative Republicans, a group of them, are still resisting President Trump's proposed health care plan to replace Obamacare. More amendments to the bill are expected to try and appease those lawmakers. Possible changes may include making Medicaid recipients work, reevaluating Medicaid block grants to states, and making tax cuts bigger and retroactive to January. Just some of the issues being debated. We are joined now by someone who was actually inside the room with the president this morning, Republican Congressman and House Budget Committee Chairman Diane Black. Thank you so much, Congressman. I appreciate it. I've always wanted to be a fly on the wall in one of these meetings. You were inside. In fact, you were called out for special praise by the president this morning for your efforts to get this thing moved through. My question to you, the first question is, what was the tone like? What was the president like in addressing these people in the room who had serious reservations about the health care bill as it stands now?
Well, the president offered the same kind of thing that we've been talking about for 6 years, and that is that this bill is hurting the American people and that they're asking us to rescue them and to bring them something that's affordable, something that they want, a choice that they want. And so the case is made. Look, the time is here. We've been talking about this. We've tried 50 times, at least since I've been here in the 6 years, to repeal this bill, and it's time to move forward now. No bill is perfect, actually, but we have a pretty good bill, and we believe that this bill will rescue the American people and give them more opportunity and choices at a cost that they want and they can afford.
But then we have Representative Mark Meadows. He's leading the Freedom Caucus. I know you're laughing. He says we still have 21 no votes, and that is enough to kill the bill. You got about, what, 48 hours now to get this thing sorted out. How many changes have to be made?
Well, I haven't spoken to him directly about his changes at the current time. We've had conversations in the past, but actually we on the Budget Committee last week were able to address some of his concerns, such as block grants and work requirements, and I know that the leadership is continuing to work with them and to find out what it is that they're the most concerned about to see what we could put in the bill. This is sausage being made. It doesn't look very pretty while you're making it, but it tastes good at the end of the day.
Is there one major stumbling block, or is it just a whole series of small issues that need to be tidied up?
Yeah, it really is more of small issues, geographically, depending upon whether you're from a state that was an expansion state or you're from a state that was not, and what are you going to do for those folks? And there are those kinds of issues that are more geographic in nature. And then, frankly, there are some people that I'm not sure that you ever completely get to where they want to be. They're more ideological in nature, and it's very difficult to meet all their demands.
Very quickly, how confident are you, and I know you're going to say yes, but how confident are you that all the votes and all the hand-wringing can be completed to get this thing through on Thursday?
I'm feeling very encouraged, and encouraged by even members that I will not mention their names, but people that I've been working with who have now come on board, and so I believe that on Thursday we're going to see a positive vote. All
right. I'm going to hold you to it. Congressman Diane Black,
thank you, Ashley.
Thank you so much for taking time to talk to me. I appreciate it.